Good morning. I'm Sherry Destora, and I'm the Region 9 Southwest lead for the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or WHIAANHPI. And it is, I want to thank all of you for coming today to our first WHIAANHPI Region 9 Southwest Roundtable on COVID-19 response and recovery. I want to remind everybody that this is closed press, and with respect to our event today, we are very excited to have our very first in-person event, and thank you again for joining us. As far as our program today, we're going to have some introductory remarks by our special guests, and then we're going to have a panel discussion of our community leaders, and followed by our representatives from our federal agencies who will provide information on COVID-19 response and recovery. After that discussion, if there's time that's available, we'll have a question and answer period, and then we'll have an opportunity to have either the community leaders and or federal partners provide comments and information on the topics that we are going to be discussing today. So without any further delay, I would like to introduce Crystal Kaai. Crystal is Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, WHIAANHPI. In this role, she's responsible for directing the efforts of the White House Initiative and Presidential Advisory Commission on AANHPIs, and advising the Biden administration on the implementation and coordination of federal programs as they relate to AANHPIs across executive departments and agencies. Prior to joining WHIAANHPI, Crystal worked on Capitol Hill for a decade, including serving as Executive Director of the Congressional Asian Pacific American Caucus for 8 years. She previously held positions with the U.S. Senate Committee on Indian Affairs, the State of Hawaii Office of Hawaiian Affairs, and the National Japanese American Memorial Foundation. Crystal was born and raised in Hawaii and is the first Native Hawaiian to ever lead WHIAANHPI. So I'd like to ask Crystal to please provide some introductory remarks.
Thank you, Cherry, and aloha and good morning, everyone. My name is Crystal Kaai, and as the Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or what we call WHIAANHPI, it is an honor to welcome you to today's White House Initiative Regional Network Listening Session for our Region 9 Southwest. I want to first extend my gratitude to Attorney General Banta and his incredible team for working in close collaboration with the White House Initiative to put together today's event. And I also want to recognize our fearless Region 9 Southwest lead, Sherry Destora, for her tremendous leadership, as well as our regional network co-chairs Paul Chang and Ben Raju, who are also present today. And I want to thank our WHIAANHPI team, including our Deputy Director, Rebecca Lee, and other staff and interns who have worked tirelessly behind the scenes to make today's event possible. This is our first in-person event of the year, and I just want to say how great it is to actually be here physically in person with all of you in Los Angeles. We know that the past 2 years have truly been unlike any other, and that is especially true for Asian Americans, Native Hawaiians, and Pacific Islanders who have faced not only the disproportionate health and economic impacts of the COVID-19 pandemic, but also the alarming surge in anti-Asian hate and violence tied to the virus. And according to a recent study by the Center for Study of Hate and Extremism, the number of reported anti-Asian hate crimes across a dozen of America's largest cities increased by 339% over the past year. And in particular, AA and NHPI women have been disproportionately targeted throughout the pandemic, with nearly 3 in 4 women having been reporting that they experienced racism or discrimination over the past 12 months, according to a survey by the National Asian Pacific American Women's Forum. And just last month, we marked the tragic 1-year anniversary of the Atlanta spa murders, in which a gunman targeted 3 separate Asian-owned businesses and killed 8 people, including 6 women of Asian descent. Both our Deputy Director and myself were able to be in Georgia, along with the Deputy Assistant to the President and Senior AA and NHPI Liaison, Erica Moritsugu, to mark that one-year anniversary with Asian American community leaders in Atlanta and to meet with some of the victims' families. And we know that there is still so much fear and trauma in our communities due to those murders a year ago that truly shook our nation to its core. Unfortunately, the recent murders of Michelle Go and Christina Yunali in New York, as well as the murders of 2 Asian American women in Albuquerque, New Mexico, remind us that the safety of our AA and NHPI communities remains a prevalent issue today. And I just wanted to say that the White House, the President, and the Vice President are very committed to ensuring that all Americans, regardless of their background, feel safe in this country. And that's why the President, on his first day in office, and that's why just last month, on his first day in office, the President signed Executive Order 13985, advancing racial equity and support for underserved communities throughout the federal government. And here, the President acknowledged that it has not been a level playing field for communities of color and that there are entrenched disparities in our laws, public policies, and public and private institutions that have often denied equal opportunities to many communities, including Asian Americans, Native Hawaiians, and Pacific Islanders. And through this racial equity executive order, the President is focused on promoting an equity agenda unlike anything ever done before. And one key component of this executive order was the creation of an equitable data working group to coordinate the federal government's efforts to ensure that we are truly able to pinpoint and respond to the needs of all Americans, especially as we continue to recover from the pandemic. This commitment to ensuring that equity is built into our nation's COVID-19 relief and recovery efforts has been a core pillar of the Biden-Harris administration. On his second day in office, the President signed Executive Order 13995 to ensure an equitable pandemic response and recovery and to establish the COVID-19 Health Equity Task Force within the U.S. Department of Health and Human Services. And within his first week in office, President Biden also issued a presidential memorandum instructing the Department of Justice and the Department of Health and Human Services to work with AA and NHPI communities in finding solutions to combating anti-Asian hate and bias, and also to address cultural competency, language access, and sensitivity towards our communities in our pandemic response. And during Asian American, Native Hawaiian, and Pacific Islander Heritage Month last May, the President signed the bipartisan COVID-19 Hate Crimes Act, which passed by an overwhelming majority in both chambers of Congress. This law brings our nation one step closer to achieving justice and equity for not just the AA and NHPI community, but all communities impacted by violence and hate. And the Department of Justice and the Department of Health and Human Services are quickly working to implement this law, and the Justice Department has already designated a hate crimes coordinator to oversee these efforts. And last May, the President also signed Executive Order 14031, advancing equity, justice, and opportunity for Asian Americans, Native Hawaiians, and Pacific Islanders. This executive order established the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders within the U.S. Department of Health and Human Services and delivers on the President's commitment to reinstate and reinvigorate this historic initiative and to facilitate improved communication, engagement, and coordination between the federal government to better serve AA and NHPI communities throughout the United States. This initiative is tasked with coordinating and executing an ambitious whole-of-government response to advancing equity, justice, and opportunity for our communities. And in addition to addressing anti-Asian bias and hate, our initiative is also focused on key priorities such as tackling health disparities and economic impacts that have been exacerbated throughout the pandemic, as well as improving research and equitable data disaggregation for our communities, improving language access, and promoting the overall educational, occupational, and environmental well-being of our communities. And so we are truly grateful to all of you here today. I know we have so many of our federal partners here in the room as part of our regional network. I want to thank all of our federal officials who are here today, and I also want to thank all of our community leaders who are here representing diverse organizations who serve the Asian American, Native Hawaiian, and Pacific Islander community. We know that, again, to truly recover from the past 2 years of the pandemic and to ensure that our communities emerge stronger than before, it is going to take all of us working together, federal, state, local, and all of you here today to make sure that we are able to truly serve our communities in the best way possible. So thank you again for being here today for our first in-person regional roundtable. We are truly grateful for this opportunity to be here with all of you today. Thank you. And now we have a part of our program, I just wanted to acknowledge we have so many dedicated public servants who are members of our White House Initiative Regional Network. And I want to recognize one member in particular, Catherine Hansen-Kin, who, Catherine, could you please come up here? So Catherine has been a longtime member of this regional network, dating back to the very beginning, and has just done a tremendous job as part of the Federal Executive Board to be really an instrumental leader in making sure that this work is sustained across administration. So
thank you very much.
We wanted to thank you for your dedicated service. We have a letter for you, some flowers.
Thank you. It's been a pleasure.
No, thank you so much for your tremendous service. The work of this initiative would not be possible without leaders like you.
We have to do a picture for Paul.
Okay, maybe we'll do a. Okay, thank you again, Catherine. And now I have the honor of introducing California Attorney General Robert Banta. Attorney General Banta was sworn in on April 23rd, 2021 as the 34th Attorney General of the state of California. He is the first person of Filipino descent and only the second Asian American in history to occupy this position. Attorney General Banta's passion for justice and fairness was instilled in him by his parents, who served on the front lines of some of America's most important social justice movements. Their fight against injustice inspired him to stand up for those who are taken advantage of or harmed, and it's why he has dedicated his career to help right historical wrongs and to fight for people who have been harmed as a lawyer, as state assembly member, and now as the Attorney General of California. In elected office, he has taken on powerful interest in advanced systemic change, pursuing corporate accountability, standing up for workers, punishing big polluters, and fighting racial injustice. He has also been a national leader in the fight to transform the criminal justice system, and he has led statewide fights for racial, economic, environmental justice and worked to further the rights of immigrant families, renters, and working Californians. Born in Quezon City in the Philippines, Attorney General Banta immigrated to California with his family as an infant and has been a true champion for our Asian American, Native Hawaiian, and Pacific Islander communities. So with that, I would like to welcome Attorney General Banta to the stage.
Well, good morning, everyone. Rob Banta, California Attorney General, honored to be here with you, and thank you, Crystal, for that very kind introduction, and thank you to the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders for hosting this convening. I also want to give a special shout out to my incredible team at the Department of Justice. We do things as a team with one another, getting more done together than we could on our own, and so let me shout out some of my amazing Los Angeles team that are here holding it down in Southern California for us. We have some of my special Deputy Attorney Generals, Damon Brown, James Toma, and Priscilla Ocean are all here in the house. I also have from my External Affairs team, Michelle Chambers and Kathleen Gonzalez. We also have our incredible interns, Radulf Mojica and Nathaniel Steele are with us today. And we have our head of External Affairs, our head of our team, Edwin Salcedo, is here. And we have my Deputy Chief of Staff, Jessica Caloza, is here as well. So thank you again for the opportunity to spend a few minutes with you. I'm really honored to join this incredible group of AAPI and Native Hawaiian leaders, and of course, so many friends, so many allies. Thank you all for doing the work for so long and continuing the work. It's as important as ever, as you know. And I want to say thank you to the Biden-Harris administration. It speaks volumes that they are prioritizing outreach efforts like this roundtable, and I like to think that it has something to do with the fact that we have two former California attorneys general at the table leading the work. You may have heard of them, our incredible Vice President, Kamala Harris, and also this initiative's co-chair, my immediate predecessor at the California Department of Justice, and also a friend, a mentor, someone who I consider a partner, just a great leader and a great person, Health and Human Services Secretary Javier Becerra, who has just been an incredible fighter for equity, for justice, for health care. And I want to just say thank you to them, thank you to President Biden, and to Ambassador Tai as well for all of their very important, very critical collective leadership. The Vice President and the Secretary have certainly left some big shoes to fill here at the California Department of Justice, but we're doing our best, working hard every day to fill those shoes. Since taking office, the California Department of Justice has been hard at work fighting for the communities that we are all fighting for in this room. We've been doing it in partnership with you as we take a note out of President Biden's playbook that we are building back better. Together, we are fighting AAPI hate. That's why I launched the Racial Justice Bureau, and many of the faces in this room are no strangers to our anti-hate crimes roundtables. We've had almost 13 of them now throughout the state and all of our big cities. And also, many of you are familiar with our newly created Community Awareness Response and Engagement Office, or CARE. Together, we are fighting for health care. Thanks in part to your vocal advocacy, my team at the DOJ won at the U.S. Supreme Court, saving the entire Affordable Care Act, a lifeline for so many of our communities during this pandemic. Proud that our Solicitor General was actually the one arguing in court in the U.S. Supreme Court to defend the durability and ongoing sustainability of the Affordable Care Act. Together, we've also fought for economic opportunity, for public safety, for housing, for racial justice. And we're engaging in this work collaboratively, having worked alongside many of the organizations here. So many of you, proud to have worked on different initiatives in support of our API community worked on bills and other important projects, including Asian Americans Advancing Justice, Asian Pacific American Leadership Foundation, the Filipino American Chamber of Commerce of Greater Los Angeles, the LA Civil and Human Rights Commission, US DOJ, HHS, and that's just to name a few. From events to meetings, from new programs to new resources, the best way to recover from this pandemic is to work together. And I'm the proud son of an immigrant mother and labor activists. As they organized farm workers for better wages and for working conditions, my parents taught me that the only way to solve problems is to solve them together. One of the incredible lessons, one of the most powerful points that I take away from the United Farm Workers of America movement is that it was a beautiful collaborative movement. Latino leaders working with Filipino American leaders and then many others in a coalition coming together from all walks of life and all backgrounds, but fighting for a common cause, and not just fighting, but winning and making a difference, transforming lives for the better. And as we stand in solidarity across cultures and communities, we break down barriers. That's how we create an equitable recovery. That's how we build back better. And that's what we're doing here at the Department of Justice. Our communities have felt so much pain over the last 2 years. I know we've talked about statistics, and the statistics bear that out, but it's personal to so many of us. The pain that's been felt, what we see in our communities, people that, some of the images I've seen when it comes to hate crimes, so many of them could be my mother. And I know we all worry about our family, our loved ones, ourselves, and our own safety. And so I want to thank you for showing courage and resilience in this very difficult moment for our community. In California, anti-AAPI hate crimes increased by 107% in 2020, year over year, in just 1 year. And across the country, in more than half of the states with available data, Native Hawaiian and Pacific Islanders have experienced the highest death rates from COVID-19 compared with any other racial or ethnic group. This pandemic has hit us hard. We know this, but our communities have also bounced back stronger, and we'll do it again. We're no strangers to obstacles and challenges, and no strangers to overcoming those obstacles and challenges when we do it together. And so many of us have different sources of inspiration. One of mine is I keep a photo in my office to remind me of how far we've come, of the progress we've made, the pain that we have felt in the past and still feel today, but also that ongoing continuum that we are on to continue to make progress, to bend that arc of history towards justice. And the photo I have in my office is it's of a sign from the 1920s, a hotel in Stockton, and that sign says, "Positively no Filipinos allowed." And we've come a long way from those days. California now has its first Filipino-American Attorney General. Filipinos are making waves and making a difference and leading, as are Asian Americans and so many of our communities that have been historically locked out and faced obstacles in the past. And that is a source of inspiration to me, because in 2022, every person in California isn't just allowed, we belong. And here in California, we look out for each other. And as your Attorney General, I'm looking out for each of you. So let me end where I began, with a big thank you for all of your work, for your partnership, your teamwork, your collaboration. Thank you all for participating in this important work today. Thank you for the work you lead every day, when no one's looking and when people rely on you and need you to fight for them. And I want to thank our host one more time, the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, for gathering us today, for convening. It's nice to see people in person. I know we've been doing a lot of Zoom meetings, and as we emerge to a safer environment, it's wonderful to continue our important work inspired by one another. So with that, let me just say thank you, and it's my honor also to hand it back to Cherry Destura when we finish a couple of photos. Thank you all. Have a wonderful day together.
Are we?
All right, you're good with me. Okay. 1, 2, 3. Thank you.
Thank you so much, California Attorney General Rob Banta, for your remarks and for joining our roundtable today. I would like to call next our leaders in our community, on the AANHPI community, to please join me at the stage. We're going to be having a panel discussion on the issues and challenges faced by the AANHPI community during the pandemic. And I'd like to introduce our leaders in our community that will be on the panel. All the way to the end, there is Tavai Samulo, the Executive Director of Empowering Pacific Islander Communities, or EPIC. Then next to her is Bo Sivan Nutsakal. She's the Director of Business at the Pacific Asian Consortium in Employment, or PACE. Next we have Connie Chung Jo, the Chief Executive Officer of Advancing Justice Los Angeles. And next to Connie is Chancey Martorell, the Executive Director of Thai Community Development Center. And next to me, and who will be our moderator today, is Manju Kulkarni. She is the co-founder of Stop AAPI Hate, and also the Executive Director of AAPI Equity Alliance. So I'll turn it over to Manju.
Thank you, Cherry. I was waiting in line at a home improvement store. A man cut in front of me in line, so I mentioned that there's a line and pointed to the line of people behind me. He blew up and started verbally harassing me by yelling, "Stupid effing chink. Go back to your country. Go back to where you came from. Do you effing speak English?" This example came from a young woman here in Los Angeles during the pandemic. Apologies for the language and sharing what is such a traumatic event. 11,000. 11,000 includes our ammas and appas, our titas, our titos, our nanis, our nanas. 11,000 is us. Because of what we saw emerging in 2020, we at AAPI Equity Alliance, along with Chinese for Affirmative Action in San Francisco State, formed Stop AAPI Hate. And since March 2020, we have received incident reports of anti-Asian hate and discrimination from all 50 states and the District of Columbia. A majority of these come from women. A vast majority of these are not crimes. Let me say that again. A vast majority are not crimes, and so they are not hate crimes. And there is not one profile of a perpetrator. They come from all races and ethnic backgrounds. With COVID-19, we have seen the reemergence of anti-Asian and anti-API hate. I say reemergence because we know our communities have experienced this racism for centuries. From the Chinese Exclusion Act and Page Act, to the imperialism of the Pacific Islands, to the Bellingham slaughter and the Chinatown massacre, to Japanese American incarceration and the Filipino Repatriation Act, to the alien land laws and the killing of Vincent Chin and Bulber Singh Sodhi, and now the killing of 6 women in Atlanta and 4 Sikh Americans in Indianapolis. Individual acts, but also federal, state, and local policies. Our communities have not simply endured the racism and experienced racial trauma, but we have resisted, and we have refused to accept secondary status. And today, we refuse to accept hate and the health, housing, and economic inequities. And that is why today's panelists will discuss not only the issues, but the critical work their organizations have been doing to address the inequities. And that is why APCON changed our name to AAPI Equity Alliance in December, to acknowledge the inequity and underinvestment our communities have experienced, as well as those tireless efforts of our 40+ members to serve our 1.5 million AAPIs in Los Angeles County. I'm so proud that these 4 panelists come from the membership of AAPI Equity Alliance. I want to thank Crystal, Becky, Cherry, the commissioners, which include Carrie Doi, also executive director of one of our largest member organizations, for their work to address inequities and for today's event. And so I'll start off with questions to Connie to talk about this hate that our communities experienced. Connie, can you tell us what the biggest challenges are to responding to the needs of AAPI communities during this rise of anti-Asian hate?
Yeah, thank you, Manju, for the question, and thank you all for being here, and to WHIAANHPI and Crystal and Cherry for inviting me to participate. So when you look at the biggest challenges our API community have had, there's a number of them. First and foremost, I would say, is language barriers. We have a community that has one of the highest population of limited English proficient and foreign-born community members as far as percentage of the population. And not only is it a very large population that is foreign born and limited English proficient, it is an incredibly diverse language diversity. So we have more than 40 different languages spoken by APIs. And it's not, they're not anywhere near the same in most cases, which means that in order to accommodate a limited English proficient API, you need to have somebody who speaks that specific language. And so it can be very challenging, I think, when you think of, we have, for example, a helpline to answer legal questions. We have 7 staff who speak 7 different languages in order to keep that helpline going. There's cultural stigma. Their communities often feel like, I don't want to go and share what happened. I don't want to air my dirty laundry, and I don't want to talk about bad things. So there's a woeful underreporting of what's happening. So we're lucky that Manju started Stop AAPI Hate because we're getting some stories, but certainly that's just the tip of the iceberg. I would also add that there was a lack of acknowledgement for the entire first year that this was happening to our community, and there was a lack of political will to respond to it. Honestly, the first year of COVID, people didn't really seem to give a damn outside of the Asian American community that we were being attacked. And it wasn't until Oakland, it wasn't until Atlanta that all of a sudden people said, oh my gosh, Asians are being attacked. Well, we've had it happening for thousands of people. And and because we also don't have as much political influence, and I don't think we've been as civically engaged historically as some other communities, it was slow going to get any reaction and to get response from different policymakers to make changes about this.
Thank you, Connie. Tavai, I wanted to ask you, we know that Pacific Islander communities have really been hit hard by COVID-19. What are some of the key lessons for the AA and NHPI community from the pandemic and from the disease itself?
Thank you for the question. I really want to invoke the words of the prescient scholar Kimberly Crenshaw, who stated that inequality is actually one of the most daunting pre-existing conditions that any of our communities have to face. And so that when we look at the devastating rates of COVID-19 in the NHPI community, what we're looking at is actually, this is what racism and poverty look like for NHPIs. This is how it manifests itself in economic precarity and health disparities. And so it was less about learning and more about the ways that it validated what we've always known, that these systems do not serve our communities, that COVID-19 doesn't discriminate, but our systems and institutions do. And so that the ways that the impact of this pandemic have been distributed have been terribly inequitable. And so what I'm proudest of and what we've learned is the ways that our communities are the experts, that even before there was data available, that we actually had, as I was talking to my dad about hospitalization rates, he says, I know Eva just got out of the hospital and your sister's going to help set up her oxygen tank. That our lived experiences are actually what we need, and that data is actually what systems waited for to validate all of our concerns, things that we were already experts on. So I think the key lessons are the ways that our communities know, even before data does, that to believe us, as Connie said, believe us when we tell you it's severe, even before it gets too bad, before it becomes our murders, our deaths, that people have to see in order to take action.
Thank you, Tavai. Bo, I wanted to ask you about the challenges faced by AAPI small businesses due to the pandemic. Can you speak a little bit about that, and perhaps also those businesses that are owned by other communities of color?
Sure, thank you. Hi, good morning, everyone. My name is Bo Sivanansugun, and I serve as the director at Pacific Asian Consortium in Employment. Before I'm going into the question, I want to give a brief background of the AAPI small business owners. I think you may aware that most of our business owners, they are doing or operating a higher risk type of business. So for example, like restaurant owner, donut store, retailer, and also like service industry like spa, nail massage, also like maybe independent contractor, like a gig worker. So just give you a perspective, like like, who they are and what they do. So I have identified 3 main challenges, for the AAPI business owners here. I think the first is definitely echo Connie's comment earlier about the language barriers. I have seen a lot of information, like, around the internet during the COVID-19 pandemic, but then maybe the information may not provide in languages. So they may have heard about the SBA, PPP loans, or like other grant available, but they may not have, a better comprehension like how they would apply for it. The second main challenge would be the technology challenge, because even though now they have information that they may be able to access to this, service and support from the public and the private sector, but due to the COVID-19 restriction that they may not access these services in person, so they have to overcome the technology challenges to apply, online and then go through like uploading all the documents. And the last challenges would be that there may not be financial documentation ready. So I would say they may not prepare their tax return well or financial statement. So as the result, all this together present challenge for the AAPI business owners.
Thank you, Bo. Chancey, how has the pandemic exacerbated the housing crisis in Los Angeles, and have the eviction moratoria and rent relief programs made a difference for housing insecure populations?
Thank you for that question, Manju. Our low-income community members live in one of the most expensive metropolitan areas, and they are rent burdened. They're actually paying over 60% of their income on rent. This translates to extreme unstable housing and high rates of overcrowding and a disproportionate risk of losing their homes in this time of economic instability. And our community members, as a result, are even more vulnerable to homelessness. At the outset of the pandemic, TICC, along with hundreds of other social justice organizations and housing advocates and faith-based organizations, we came together and formed what we called Healthy LA. And what we did immediately, we pushed for eviction moratoriums and moratoriums on rent hikes and utility hikes in the city of LA and the county of LA. And as a result of that, we did get these moratoriums, which was extremely helpful because we had families and households who were in distress and were not able to return to work. They were furloughed, or they had a reduction in their work and a loss of income by a significant amount, and therefore were panicking and not realizing how they're going to really make rent and stay housed. And as a result, the city then had this eviction assistance program called the Emergency Rental Assistance Program. And we were able to work with the city of LA and the county of LA as well, that came out with its own program to help our immigrant communities apply for rental assistance. Now, there's barriers and challenges to that because a lot of times they don't have the technology to go into the portal to apply. So TICC happened to be one of the organizations that had to help with the application process. And then Stay Housed LA was created, coalition of legal aid organizations that now can provide the legal aid and counsel to families and households that end up receiving an eviction notice and need to be given some counsel and provide some representation. And TICC also now has an eviction defense program to navigate people through the eviction process, which at this time is illegal because there's still a moratorium in place. But a lot of our immigrant members don't know that.
Right. So to follow up on that, what recommendations do you have long-term to increase access and equity for vulnerable populations?
Well, TICC, we at the outset of COVID, had triaged, and we created the Thai CDC CARES, the COVID aid relief, rapid response, and emergency services. And as a result of that, we were able to actually get funders to recognize that there's an issue of health disparity in low-income marginalized Asian communities, and there are language barriers and cultural barriers, and therefore we could not access a lot of the public health directives because they're not in language. And so what we found had been successful was trying to really bring together not just a coalition of community-based organizations and faith-based organizations and partners within the city and county. We found that we had to really impress upon especially the county, the importance of getting language materials out, but importance of getting vaccinations to the community as well as testing. And so we ended up through these types of partnerships, ended up actually operating our own vaccination clinics and testing clinics. And then funders realized that a lot of immigrants, especially undocumented, who didn't have any safety net, needed cash aid. And so we were able to actually get funding to disseminate cash aid to individuals who didn't have that safety net, didn't qualify for the federal stimulus, economic stimulus, nor the California unemployment benefits. So it's really important to really advocate for those who cannot speak up for themselves, who are marginalized and voiceless, and let folks know that these are folks who are not able to access any of those benefits, and not let them be left to fend for themselves without any kind of aid or resources.
Thank you. Bo, back to you, a similar question. What are your recommendations on how AAPI small businesses can be supported moving forward?
Sure. I have identified 3 strategies. I have the exit strategy, short-term strategy, and also long-term strategy. For the exit strategy, I think we have to first evaluate whether the business was doing well or not before the COVID-19 pandemic, right? With the limited resources, we may have to advise the business owner maybe to talk to public counsel or legal aid, or maybe to pivot their business model to adjust to the current economy. For the short-term strategy, I have seen both the public and private sector have addressed it along with the nonprofit, which is to provide the working capital through grants and also through loans. And also, like for the nonprofit like PIS, we provide technical assistance as well. For the long-term strategy, I think is to help create more revenue for these small businesses. So for one of the example is what we have done is that the procurement technical assistant. We recently awarded as the minority business development agency. So we assist all the minority business in procuring like private and also public contracts. This is the definitely like untapped opportunity for AAPI and also other minority business as well. It may not applicable to all businesses. For other businesses, we provide like closely technical assistance program. And then also, as I mentioned earlier about the financial ready, including the credit counseling as well. So then they are prepared not, for the next COVID-19. I keep my finger crossed here, but maybe, whatever come in the future. Yes.
Thank you. Tavai, you provided us context for, why COVID happened and the disproportionate impacts it had in terms of, essentially the permanent racism and white supremacy we've seen in our country. What is the role of government agencies in supporting the recovery of NHPIs?
Yeah, thank you for that. So in thinking about this, I think it's really critical to name, I'm critical of data, obviously, because I don't think anything is neutral. I also want to talk about the role that data disaggregation played in being able to see the severity of the situation. I think data that's most neutral really allows us to measure the severity of an issue and also the efficacy of a solution. And so I think I push for data disaggregation and want to name that the majority of states do not disaggregate data. So the majority of states are actually not ready to measure the solutions that we are posing in order to meet them. So I think it's about making sure that as federal agencies that you are disaggregating data, that you are prepared to receive our communities and our solutions. I think the other component to consider and really be clear about that is a celebration in December 2020, the restoration of COVID Medicaid at the federal level. That is now, we're closely monitoring state implementation. So the restoration of COVID Medicaid only came after people were able to see that this entire community that has not had access to health care paid severely, that they accounted for 0.5% of most populations in the counties that they were in, and still a quarter of the deaths. So now what was incumbent upon us is to look at all of the other benefits that they've actually been excluded from FEMA funeral assistance to employment to all of the things that were actually taken away with welfare reform in 1997. I think the last piece is how are we actually partnering with NHPI leaders and NHPI organizations who are the ones that are on the ground and the best equipped to actually name the problems and the solutions, and being really clear that our communities and our cultures are not a deficit. They're actually an asset to making sure that our communities are safe, healthy, and protected.
Thank you, Tavai. And Connie, how do we think about building safety for our AAPI communities in a way that shows solidarity with other communities of color?
Right. So I think one thing that's important is we need to reorient from talking about anti-Asian hate crimes and really focus on hate incidents. Because as Manju mentioned, the majority of the hate we've seen have actually not risen to the level of a criminal activity. So when we focus too much on the crimes component, then you lose out on serving a lot of victims who've faced a lot of trauma. I've talked to people who've been threatened with their lives. They've been spat on. They've been towered over as women by men that they said, I was scared for my life. But it did not rise to the level of a crime because it was speech. We need to address those situations as well. So when we focus too much on hate crimes, we're not doing it. The other thing about focusing on crimes is what we've learned, especially through the Black Lives Matter movement, is that the criminal justice system disproportionately hurts certain communities of color, particularly the Black community. So if we focus on interventions that we feel, okay, maybe this is going to create safety for our community, but at the expense of other communities of color, that is not a good solution. In 2 weeks, we mark the 30th anniversary of the LA uprising, which happened in the wake of a verdict of acquitting 4 white police officers of Rodney King's beating that was videotaped at that time. And in that situation, there was $1 billion in damages. 63 people's lives were lost over 6 days. And 40% of those damages were in Korean-owned businesses. And so in the Korean community, we call it 사이구. And what was interesting is to see how the Korean and Black communities were pitted against each other at that time. And we also know at that time that those businesses in Koreatown burned to the ground because the police and the firefighters didn't come to us. They went to Beverly Hills and they went to Brentwood. And so what we've seen is historically challenges where our policies and sometimes our government and sometimes our criminal justice system has pitted communities of color against each other, and the Asian community is often treated as the model minority. And this is an historical practice that when you create that kind of racial hierarchy, communities fight with one another. And what we don't do then is collectively look at keeping our eye on the prize, which is addressing racial inequality for all of us, right? And so that is one of the challenges of when we say, okay, we need safety for our community, and so we want more police on the streets, knowing that that is not going to address all of the hate incidents, knowing that many of our community members are also very intimidated and weary of going to the police. If you're LGBTQ, if you're undocumented, if you come from a community where historically that country was not good to you if you went to the police, there are a lot of our community members that are scared as well. And so I see too much focus on hate crimes legislation and policies, and not enough on things like long-term prevention programs such as Asian American ethnic studies. Let's add more dual language immersion programs so kids are exposed to different languages. Let's focus on the data disaggregation that Tavai mentioned. Let's focus on anti-discrimination laws that Stop AAPI Hate is working on. Let's focus on some of these other areas that seem to be getting disregarded or not enough attention because of the focus on hate crimes.
Thank you. And I just want to thank all of our panelists for their very thoughtful answers and really just the amazing work that they do day in and day out in serving our communities. Their tireless efforts really are what have really enabled many in our community to stay together, to continue to feed their families, to have housing, to survive COVID. So I just want to acknowledge all the work that you all do, and thank you all for the opportunity to share that with you today. And I'm going to turn it back over to Cherry.
Thank you so much, Manju, and thank you so much to our leaders in our community for joining us today, for taking the time to share your insights, and for the information that you provided. I'm going to now ask to join me on the stage is our federal agencies who have information to provide on COVID-19 and response. And before we start with our federal agencies, I'd like to make a special acknowledgement to Carrie Doi, who has joined us today, who is a commissioner on the President's Advisory Commission on AANHPIs. And there's Carrie there. Thank you for joining us today. And I'd also like to acknowledge our additional commissioner, Dr. Reynaldo Samoa, if he's here today. Thank you for joining us here at our roundtable. There he is. So I'd like to introduce our members of our federal agencies who will be providing information on COVID-19 response and recovery. First, we have Jason Poo, the Regional Administrator for Region 9 at the U.S. Department of Housing and Urban Development. Then we have Justin Locke, the U.S. Department of Justice. He's a Community Relations Service. Next, we have Commander Michelle Sandoval Rosario. She is a PACE Region 9 Director at the U.S. Department of Health and Human Services. And we have next Christine Park Gonzalez, the Acting District Director at the EEOC Los Angeles District Office. And last and next to me is Victor Parker, the Deputy Associate Administrator of the U.S. Small Business Administration. So I'll start it off with Jason to provide information on COVID-19 and response, and have Jason then turn it over to the agency to your right. Thank you so much, Jason.
All right, thank you. Hello, everybody. I'm Jason Poo, the still new Regional Administrator for HUD Region 9. It covers the states of Arizona, California, Hawaii, Nevada, and American Samoa, Guam, and the Northern Marianas Islands. I was appointed to this position by President Biden at the end of last year, and I started on January 3rd. Many of you know me as the former community advocate, business attorney, and mayor and council member for the city of San Gabriel. It's an honor to be here with all of you and to see so many old friends and also to meet some new ones. So I also want to thank Cherry Destura, and I guess you're pronouncing it WHIAANHPI. I submit that respectfully that at times we could also pronounce it We Ain't Happy. And so thank you to Cherry and WHIAANHPI for organizing this event and for inviting HUD to be part of this important conversation. At HUD, over the past couple of years, we've been doing so much to advance equity and promote justice and opportunity. We've been working on COVID-19 response and recovery, and we've been working with our community partners to help lower income and underserved communities affected by COVID-19 address their housing and health needs. All of last summer, we worked alongside community-based organizations and HHS to connect HUD-assisted households and the public to COVID-19 vaccination sites and resources. These efforts resulted in over 1,300 COVID-19 vaccination clinics nationwide. Here in Region 9, our team conducted over 350 activities, including outreach to community partners and stakeholders like Thai CDC and KYCC, who support the Asian American and AANHPI communities. Today, we continue to provide critical and timely information about the COVID-19 vaccine, as well as other resources such as locating the nearest vaccination clinic. I just wanted to mention, too, that the eviction prevention work that Chancey mentioned earlier, those are actually HUD programs that are administered through state and local entities. So additionally, HUD has housing resources to protect renters facing eviction, as we just mentioned, and homeowners struggling to pay their mortgages. You can find more information at hud.gov/coronavirus, and we've included them in the resource guide for today's roundtable. In fact, our very own Angela Huang, who is stationed here in HUD's LA office and was with us here today, led some of these efforts across the entire nation. We're proud of the work that she and HUD has done with our state and local partners to help people stay in their homes and thereby help to prevent homelessness in this time when we know that so many people have fallen behind in their rent or mortgage payments. HUD's also working to remove barriers remove the barriers of access to homeownership for people of color. Like other homeowners of color, AANHPI homeowners have faced barriers to homeownership and discrimination in the housing market. On March 23rd, President Joe Biden, Vice President Kamala Harris, and HUD Secretary Marcia Fudge announced the Property Appraisal and Valuation Equity Action Plan, or PAVE. PAVE is an interagency effort, the first of its kind, aimed squarely at dismantling racial bias in home lending and appraisal processes and promoting generational wealth creation through home ownership. This action plan is the most wide-ranging set of reforms to the home appraisal process since Congress passed landmark financial reform legislation in 1989. The PAVE task force is co-chaired by HUD Secretary Fudge and White House Domestic Policy Advisor Susan Rice. Again, it's the first of its kind interagency initiative to address racial bias in home appraisals, and it strives to address discrimination in appraising home values and hold the appraisal industry fully accountable for systemic racial disparities. Just as a side note, I saw a statistic today that according to, I think, the Bureau of Labor, 98% of appraisers across the country are Caucasian. I think we need to check that because that sounds almost unbelievable, but I did see that earlier this morning. So finally, I'd be remiss if I didn't mention that April is National Fair Housing Month. And Fair Housing Month underscores the Biden-Harris administration's commitment and progress toward advancing equity in housing and securing equal access to housing opportunities for all, including for AANHPI community members. HUD's efforts in fair housing work to enforce our nation's fair housing laws, to fight against discrimination in housing, lending, and as I mentioned, in property valuations. And as you know, federal discrimination laws civil rights laws, protect against discrimination on the basis of race, color, national origin, religion, sex, including now gender identity and sexual orientation, familial status, and disability. So these are just some of the efforts that HUD has been undertaking over the past couple years and continue to undertake in partnership with our other federal, state, local, and tribal partners. And we're seek to continue to assist all of our communities survive and emerge from this COVID-19 pandemic. A collection of these and some of the other resources are provided for you in the folders that you'll have. And again, thank you for having HUD at this table. We look forward to our continued partnership with WHIAANHPI, or as I say, sometimes we ain't happy. And and find ways that we can continue to support our AANHPI communities as we rebuild and recover from COVID-19. And in that regard, I'm also proud to announce that Ming Guo, who's one of our, also from our Los Angeles field office and who's here today, will be joining the effort, the WHIAANHPI effort on detail in just a few weeks. So please give her a round of applause and thank you once again.
Good morning, folks. It's great to be here. I want to extend my thanks again to WHIAANHPI leadership, Executive Director Crystal Kaai, Deputy Director Rebecca Lee, of course, Ben Raju and Paul Chang of the regional network, and of course, Cherry from this region for putting on this important event. My name is Justin Locke. I'm the Special Assistant for AANHPI issues for the U.S. Department of Justice Community Relations Service. For those of you who may have not had the chance to work with us or look us up on Wikipedia prior to this event, we're a small component within the U.S. Department of Justice that is charged under Title 10 of the Civil Rights Act of responding to community tensions on the basis of race, color, and national origin, as well as under the Matt Shepard, James Byrd Jr. Hate Crimes Prevention Act of responding to and preventing violent hate crimes on the basis of not only race, color, and national origin, but gender, gender identity, sexual orientation, and disability. Now, I think the work that the CRS does is unique to this problem, one of the problems facing the API community today in the form of AANHPI Hate, in that the DOJ CRS is not an investigatory or litigatory agency. We don't represent parties in court. We don't make determinations of fact, investigate, or serve in a law enforcement capacity. Rather, we are community mediators and conflict resolution specialists when it comes to these disputes that really tear at the fabric of who we are as a community, who we are as Americans. The services that we provide, as I mentioned, are a little bit different than what people normally associate with a justice component. Rather than represent parties in court or investigate or make determinations of fact, we provide mediation, facilitation, training, consultation, and those type of services, really leveraging the expertise of communities. And as some of the members of the previous panel said, including Tavai and some others, the real experts are in the community. And so for those of you joining us via the live stream, I wish you could see what's on the other side of this table, which is a room full of socially distanced people from community groups, organizations, just everyday members of community that are interested in addressing these issues, this wide range of issues, from inequity in health, housing, to hate and bias. This agency, the DOJ CRS, we are available at no cost to communities. We act in a neutral way. We don't, as I said, represent individual parties to a dispute. Rather, we are here to leverage the expertise of communities to bring them together to come to a mutually agreeable solution. We don't impose or direct any particular course of action. We're here to, again, facilitate a process where the solution that comes out of this is something that communities can live with themselves. And oftentimes, those solutions are more creative, more durable, and have more buy-in than anything that so-called experts could imagine. And so I want to leave you with that. We serve all 10 federal regions of the United States, including Hawaii, Guam, the Pacific, and we'll include some information about our services specifically in the resource pack that'll be sent out. Thank you. And with that, I'll pass it over to the next speaker,
Great. Hello. Okay, great. Hi, good afternoon, everyone. Thank you for having us on behalf of the Office of the Assistant Secretary for Health, the Region 9 Acting Director, Regional Health Administrator. This really is an honor to be here. I want to just highlight before I go into my talking points, one thing that I've heard over and over is injustice, the health inequality, the racial injustice, and I will say it's such an amazing time, and I'm so proud to represent HHS and an administration, as we heard, that gets it. They know what we need to do, right? When we talk about homophobia, discrimination, racism being as a public health issue. You all know this for decades, but today we can actually say that our administration and our HHS leadership supports us. So this is really the time for us to learn from you all, learn what you've been doing in the communities with faith-based organizations, grassroots organizations, to know what we need to do to address the racial, the inequalities, the racism that we have been seeing for decades. And unfortunately, I always say the silver lining of the COVID pandemic is that it has opened up that opportunity to highlight, speak out, and hear from all communities. So I wanted to just pause and reflect that, what I've been hearing, and also the support that we have from our administration and our HHS. What I want to focus on is what we have been doing since the beginning of COVID, since the first evacuees in January of 2020, that we all saw how this COVID unfolded over almost what we could say 3 years. We here in the region and across HHS have been committed to partnering with our local, our states, our counties, our tribes, our territories, our freely associated states to really support their efforts by providing PPE, testing supplies, treatment, vaccination. We continue to do that. But the only way we can be successful is by partnering with you and being here today. So again, I appreciate it. I also want to acknowledge the discussion we had with data disaggregation, right? That's a huge issue. We have not been able to unpack the true disparities that we see in our communities. So we are working tirelessly and hard across HHS to make sure we address those barriers, because we're not going to be able to unpack, right? We know how diverse the Asian American, Hawaiian Native, and Pacific Islander community is. We've heard it. We've known this for decades. So that's something that we are committed, and I wanted to reinforce that because that's something we heard over and over. I also want to say our priorities moving forward with the pandemic. We're still in the pandemic. We're not in the clear. So we're really focused on building vaccine confidence to increase vaccination. We've seen, unfortunately, all of the misinformation because of not only many partners, but the provider bias. Because of the discrimination, we see how our communities don't trust us, right? They don't trust the federal government. They don't trust public health. So we are working with all of the communities across many entities to be able to increase vaccine confidence. And I want to say, I'm proud to say that recently, close to 10 million funding that is going from the American Rescue Plan. Those 10 millions are going to the Association of Asian and Pacific Community Health Organizations that support 33 states and territories. And the focus of these funds is going to be specifically in increasing vaccination, addressing the medical mistrust that we see in our communities, and working with different entities. So I'm very excited about this. And these are opportunities that I'll make sure I highlight in our resource guide. I also want to talk about something that I haven't heard, mental health. Mental health, substance abuse has rated across all of our communities of color, right? So that is something that our administration and HHS is very focused. We have begun to launch several campaigns and funding opportunities. I will make sure I highlight those in our resources to really tackle what the pandemic has done to all of our mental health. It's personal to me, it's personal to all of us. I think the isolation, the unknowns, the deaths, losing our jobs, our homes, has really created a mental health. It's impacting our youth. So we are working really hard with different entities, not only across HHS, but across the federal level, to make sure all of you have the tools, the resources. And I think also what we heard from our panel, making sure that these are culturally appropriate. I always say there's a difference between culturally appropriate and language appropriate, right? We want these resources to be developed from you all, from those communities that know the communities. When we talk about mental health, when we talk about the stigma, discrimination. So those are things that we're really focused. And finally, I want to highlight and say the syndemics. COVID is here, but when I talk about syndemics, I want to refer to what we were hearing about HUD. It's not only COVID, right? It's all of those things that are coming together that are impacting health inequalities in racial injustice, housing, substance abuse, access to services, access to fair housing. All of those stuff makes a difference. So we at HHS, with the support of the administration, are working very closely with many of our federal entities to make sure that we are addressing all of the syndemics that are impacting our community. So it is really an honor to be here with you today. I am located in Los Angeles, California, so us and my team are here to support your work, and hopefully we can continue to work together and address many of the racial injustice that we continue to see in our communities. Thank you.
Good morning. Thank you for having me here today. My name is Christine Park Gonzalez. I'm the Acting District Director for the Equal Employment Opportunity Commission, or EEOC. When it comes to AAPI hate in the workplace, we are your federal resource. We are a federal civil rights agency that enforces laws against discrimination and harassment in the workplace based on your race, color, national origin, sex, religion, age, disability, and genetic information. So what does that mean? If you or someone you know has experienced, denied a job, denied a promotion, paid less, treated differently, or harassed at work because of your ancestry or your country of origin, there may be a violation of federal law. Our agency is nationwide. Obviously, my jurisdiction is Southern and Central California, Southern Nevada, Hawaii, and the process starts with a charge. Anyone can file a charge of discrimination, and for those that are afraid to come forward, third parties can also file charges on behalf of others. For us, jurisdictionally, we require that the employer has at least 15 or more employees for most of the laws that we cover, 20 or more for age discrimination, and just one for unequal pay between men and women. We also require that the last act of discrimination occurs within 300 days of the charge filing date. For us, we have a vast staff. I have an office here in Los Angeles as well. I have staff that speak several languages, and we also use teleinterpreters too because we don't have all 40 languages that was referenced by the prior panel. We rely very heavily, I'm looking at our partners in the front row. I'm such a fan of your work, and I really appreciated the information that you provided earlier today, and it is critical to the work that we do. As someone mentioned before, this community does not come forward readily, and so our partners are really that bridge between us and the community groups. So I'm looking at folks that have already referred cases to us. Chancey of the Thai CDC, she referred a case involving Thai farm workers who came in by the hundreds, who were placed onto farms in Washington and Hawaii states. They were not just harassed, but they were trafficked and treated differently because they were Thai. They would not have come forward if not for Chancey and for her organization. I'm looking at our regional attorney, Anna Park, hopefully you can stand up, who's done a tremendous job in litigating these cases for us. She is just fabulous. And we have a variety of services. So with the charge, we serve the employer. We have a mediation program to try to resolve cases early on, should the parties agree, led by the fabulous Cherry Destura, who's been doing a great job leading us here today. We do investigations, we settle cases pre-litigation, and our services are free. They're free and confidential until Anna has to step in to litigate. So, we're here for you. We've done many of these cases for many, many years, but obviously there's an uptick. There's still a gap in terms of the uptick of hate incidents, that Connie referenced, and actual people coming through the door. But again, we're here to help. We are all here as resources, and so we have our website, www.eeoc.gov, where people can actually start the process. But if that's too cumbersome, just give us a call and we'll walk you through. I'm happy to talk some more. I think my time is coming up to the end, but I will stay afterwards to answer any questions or concerns that you have. With that, I'll pass the baton to Victor.
Good morning, everybody, and thank you so much for having me. It's a pleasure to have you here as the executive director. It's really nice for you to come to Los Angeles and to visit with us. And thank you to Cherry for having me. I am Victor Parker. I'm the Deputy Associate Administrator for the U.S. Small Business Administration. I am responsible for all of SBA's 68 district offices across the country, as well as our 10 regional offices. But right here in Los Angeles, you all are under the great leadership of Ben Raju, who is here in the room today, and I want to acknowledge him as not only the District Director for Los Angeles, but as the National Co-Chair of WHIAANHPI. So you all are in good hands, and that's what I want to start with. As far as the Small Business Administration is concerned, it's been all hands on deck, as you all are aware, ever since the COVID pandemic started. We have been able to execute not only the Paycheck Protection Program and our COVID economic injury disaster loans, but several other specific grants and programs related to helping our small business community right here in Los Angeles, which is really the capital of small business. Oftentimes you will find that Los Angeles has the largest number, not only of actual businesses, but businesses in terms of number of loans, contracting opportunities, as well as the technical assistance that's provided by many of our partners who you heard earlier today, including Pace and our commissioner that is here, Carrie Doy, as well as Bo and her leadership. Thank you so much, as well as Thai CDC, who is also a part of our network of resources that we provide for all of small businesses across the greater LA area. So as we look going forward, a couple of things I want to make sure that folks are aware of that you may be able to help us get the word out, because that's the important part, is making sure that the community is aware. And as Bo stated, it is very clear that the types of businesses that are traditionally in underserved markets or in markets that need attention, including the Asian market, are those that were most hardly hit by the pandemic. Those are the smallest of the small businesses. It's the retail businesses. It's those folks that are sole proprietors. It is those folks that are dealing with restaurants. Those are really key industries and markets right here in Los Angeles that are just critical to our economic recovery and economic growth. And so going forward, we're going to continue to work with our folks at PACE and Thai CDC to make sure that information is provided in language. Right now, those folks that have received the Paycheck Protection Program, there's a forgiveness process. And so we are working very closely with our partners and with small businesses to make sure they are aware of what that process looks like so they can apply for that forgiveness. The same will happen with the COVID economic injury disaster loan, where we will have folks on board and on the ground to help go through that process of making sure we are prepared for repayment as we recover from this pandemic. As somebody just stated, the pandemic is not over. We are here. We're going to have to roll up our sleeves. There's a lot of work to be done, and we can't do it without all the great partners and the folks that are here in this room. The next thing I do want to kind of mention really quickly is our expansion of a lot of different programs. Under the Biden-Harris administration, we have now launched the Community Navigator Program, which is $100 million that was distributed to several different community-based organizations to help us further reach communities and help them with small business and economic development assistance. And so right here in Los Angeles, you will find that we have got great community navigators right here on the ground that will be able to help you, and you'll get more information about that in the resource guide that will be provided to you. So if you hear nothing else that I say today, get to know your Los Angeles district office. Go to the district office. We have a great team under Ben's leadership that is here to help you, whether it's access to capital, whether it's contract and procurement opportunities and capacity that we want to help to build for our small business community, as well as connecting you with Thai CDC and PACE. Our community partners are going to help us to grow. So thank you all again for having me, and thank you for being here.
I want to thank again our federal partners and federal agencies for taking their time today to provide very valuable information on COVID-19 response and recovery. And so I'd ask you to return to your seats. Thank you. So we are at the question and answer period of our roundtable, and we only have time for 1 or 2 questions. And so these questions were pre-submitted prior to registration. So I would like to call Connie to respond to this question. If you could just be at the front of the stage, because as you all know, this is being live streamed. So Connie, what do you feel are the most important interventions or policies that government and community leaders should prioritize to curb anti-Asian hate?
So one thing I would mention here is I forgot to mention that we do know Asian American women have been disproportionately impacted than Asian American men. And when I've spoken to Asian women victims, what they've told me is 2 of the barriers they faced for reporting was the lack of, that they were embarrassed and ashamed, and they were afraid they wouldn't be believed in. And I mentioned this because I used to run a domestic violence organization. And so those were the same barriers in the gender-based violence space as we're seeing in the anti-Asian hate space. So I would say there are probably some policy lessons that can be borrowed and interventions and lessons learned from that space on how to overcome barriers and challenges for victims of anti-Asian hate. I would also mention focusing on different interventions, as we talked before, about going beyond just looking at criminal law enforcement and thinking about other areas such as legal discrimination laws, looking at education. And I would say, instead of criminal justice, can we look at things like restorative justice programs, conflict resolution programs, programs that also build interracial solidarity building. So I'm working with KYCC, Korean American Coalition, Korean American Federation, LA Urban League, and First AME Church, and we're doing a joint event to commemorate the 30th anniversary. We're sending a media alert, I think, like right now. It has been really interesting to try to build bridges even 30 years later. There are still sensitive moments that happen in our communities as we're planning and having these discussions. And I do still see these sparks of interracial conflict in our communities, certainly in LA, but you hear about them all over the country. I think the government could be focusing more on not just looking at what one community needs, but how to build interracial solidarity building and build and incorporate some of those programs, as well as intercultural solidarity building that would include intersections such as gender and the LGBTQ community, and create opportunities for learning there, as well as to strengthen relations and reduce the conflicts that have led to some tensions and issues we've had in the past.
Thank you so much, Connie. I wanted to call Tavai to answer this question. Tavai, what is the key lesson learned for the AA and NHPI community from the pandemic?
Sure. Thank you for the opportunity to expand on it. I also, now that I don't get to hide behind the table, I want to preface, because if this is live streaming, I can hear my mom being like, they're going to think someone's don't iron their clothes. That's also the burden of representation. But no, I appreciate it, because as I was speaking, I also realized that something I forgot, that one of the greatest lessons learned too from the pandemic was, what does it mean to actually have public health that centers everyone? Something that was really great and that I know recently expired on April 5th was actually all of the coverage for those who are uninsured. And as I said, COVID-19 and its Greek alphabet of friends does not care if someone's insured. So it's actually incumbent upon us to take that responsibility. And that the uninsured goes beyond just immigration, because insurance is also tied to employment. So how do we think about the ways that our systems serve everyone, that prioritizes their humanity? The other component is, I'm going to continue to punctuate this piece around data, because for so long data has been weaponized to erase our communities, to tell us that we're statistically insignificant. So how do we understand data and measuring our proximity to equity, and also deciding that the way that we distribute resources is not based on the size of a community, but the size of the impact of inequity and how it shows up? Thank you.
Thank you so much. And our last question, if I could ask Justin to Thank you, Justin. What has the government done in ensuring that victims of anti-Asian hate are informed on next steps and other information on the investigation or prosecution of the attack?
Sure, Cherry. That's a very prominent question, one that we encounter often in the field dealing with communities that are facing and recovering from bias and hate. What the government has done on a variety of levels is to increase its own capacity in victim witness services. That includes language accessibility, cultural appropriate and culturally aware responses to victim services, and incorporating what some of the community panelists have said. That also rolls into sort of a trauma-informed response to hate and bias. Are we embracing a whole-of-government approach to victim services to ensuring that they understand what is the process, the investigative process, and the litigatory process, and in the case that, as Manju said, the majority of incidents are simply do not meet the legal definition of a hate crime. If they are, and I don't want to say just a bias incident, but if they are a bias incident as opposed to a hate crime, are we communicating that with a degree of clarity and with a degree of sensitivity to communities in a way that is not dismissive, to understand that there is a negative impact, that there's a trauma, not only on behalf of the individual victim, but on behalf of a community. And I think that that's one of the things that make this issue of of racial bias and hate unique, in that the impacts can affect somebody who may not be the direct victim, right? And so are we sensitive to that as well? Are we taking a whole of government, whole of community approach and addressing those needs that may deal with things like food insecurity, economic opportunity, housing and education as well? And so I think that those are some of the things that we're doing and that we can do and that we can do better. And finally, I think one of the things that we continue to do is listening. And so I encourage everybody here or on the live stream to continue continue this conversation and this dialogue and talk with us. Let us know what we can do better in serving your needs.
Thank you so much, Justin. And so, unfortunately, we are at the end of our program, and I just wanted to let everyone know that this is, we hope, the first of many opportunities for roundtables for our community, our state and local officials, our federal partners, and our community organizations to continue our conversation as to the issues and the challenges that we are facing, and to come together for possible solutions so that we can work together as we recover from the pandemic. So I want to extend a thank you again to the community leader panel, to our federal agency panels. Also a special thanks to the California Attorney General's office for providing us the support and this opportunity to use this amazing space to be able to come and meet together. And of course, I want to again thank Crystal for being able to come out to our region to have our first roundtable. After this event, I'll be sending out a resource guide of information from federal agencies that have provided information here today, and any other federal agencies that'd like to provide information on COVID-19 recovery and response, and I'll be sending that out in an email. So thank you again, everyone, for attending our roundtable, and we hope to see you again soon.